Manchester United and England left-back Luke Shaw has vowed to come back stronger after he suffered a double fracture of his right leg during United's 2-1 defeat at PSV Eindhoven last night. He was treated on the pitch. He required oxygen following that pretty brutal tackle by Hector Moreno. But just how big a challenge does he face in coming back from a broken tibia and fibula? Dr. Ralph Rogers is a consultant in sports medicine. Good morning.
Morning.
He was in tears, we're told, in the dressing room. He looked in a lot of pain, understandably, but then was tweeting about an hour later. So he was obviously in good hands. Now, what's the process from here?
I'm sure he was in excellent hands. He'll probably fly back and have his surgery. And then the rehab process begins immediately.
And how effective can the surgery be? Can it? What's involved in that?
Well, I'm not a surgeon, but we've seen this type of injury before. And I'm not going to go into the details of what I know about surgery because I'm sure I'll get it wrong and somebody will say, look, we do it this way now or something like that. But
well, that's fair enough. In that case, let's concentrate on the rehab because actually that is
right.
going to be the most key element in terms of his recovery, isn't it?
And that is the key element, is, getting back. And that, we're looking at probably anywhere from, I would say, 6 to 9 months. I've heard some people throw around he'll be back in 6 months, but it's depending on what type of fracture it is. We don't have all the details. So again, it's never safe to assume. But
will he be able to do anything at all initially after surgery, or will he be completely laid up, presumably at first?
No, they'll get him up pretty quickly to start the rehab process.
Give us an idea. What kind of exercises would you start with? What kind of movement would you begin with?
Well, I'm sure Manchester United has all the latest gadgets. As soon as he's able to walk and mobilize, he will be able. There's things called Alter G, where it will allow you to mobilize with less of your body weight, because you want to get people moving. You want to get the joint moving. You don't want it to get too stiff. But like I said, I'm sure he's in excellent hands, and it's not written in stone. It'll be according to what he can do when he can do it.
Thank you very much, Dr. Ralph Rogers, who is a consultant in sports medicine.